Good morning, everybody.
Good morning.
Once upon a time, there was a cliff. A cliff of good health. And here's how the story goes. As I walked out to the edge of the cliffside, as I walked out in my backyard one day, I tripped on injustice and fell to the bottom. Fell to the bottom, and there I did lay. I made quite a mess down there, and the people in the town knew they better do something about this dangerous and messy situation. So they had some workshops and some hearings and some meetings with hospital administrators, and they decided on their plan to put an ambulance at the bottom of the cliff.
What's your ETA? We'll be there in 2 minutes. Come on, we have flights to save here.
Now, were you in those meetings? Okay. The next guy who lived near the edge of the cliffside, who tripped on a rock and went over the edge. He landed below but was saved by the medics, and off to the ER the ambulance sped. Okay, now this seemed like the perfect solution in the beginning, but of course more and more people started pulling off the edge, and there was only one ambulance to put them on, and the ER started to fill up, and they really needed some new ideas. So the local high school coach had a great idea to catch people before they hit the bottom. So they decided to put in a net. Was that your idea too? A child who lived too near the edge of the cliffside was playing and tumbled right over the side. She landed quite nicely in the new net of safety till someone could pull her back up with a line. Now, there were still people going over the edge, though, and things started to get a little crowded in the net, just like they were in the ER. The net wasn't big enough to catch everyone, and not everyone got pulled back up. So this time, a very smart person who had just moved to town with a master's in public health degree said, let's build a fence at the top of the cliff so no one can fall off. Whoa, what a great idea! Did you think of that? So now when the children play out near the cliffside, they can't tumble off, and we know they won't fall. But somehow the danger is too close for comfort, and something is needed to finish this all. So this time a very, very smart person who had a master's in public health and a degree in community planning said, why don't we move the houses away from the cliff edge to a safer area? And so they did just that. Did you think of that one? The people were happy, the children played safely in green neighborhoods that were far from the edge. They lived all together with no fear of falling. They cared for each other in common, they said. But that's not the end of the story.
Oh, what happens next?
Oh, one day, a social earthquake of mass inequity hit the cliff, and there was much shaking and breaking and splitting and quaking, and suddenly the two sides of the town on top of the cliff were looking quite different. One side of the town was a place of great beauty, with means to stay healthy and good jobs for all, where children were safe and could play with their neighbors, far from the danger and caring for all. The other side of town got pushed back to the cliff edge, where public investment and resources lacked. The fence was all broken, the net was all holy, the ambulance broke, and the tires were flat. That's right, one side of town flourished far from the edge of the cliff, and if anyone happened to wander that way, the well-maintained fence would keep them from going over the edge. And even if they managed to slip over the fence, the safety net would catch them. And if for some reason they managed to slip through the safety net, there was an ambulance waiting at the bottom to whisk them away to a high-quality ER. Everyone at the top and bottom of the cliff was working together to make sure everyone was taken care of. Meanwhile, the other side of town balanced precariously on the edge of the cliff, with a fence that hadn't been maintained for years, and a tattered safety net that everyone fell right through. And down there at the bottom, well, the ambulance usually didn't work, and even if there was one, and often it was more likely to be a police car showing up and taking away the folks that hit bottom straight to jail. Now that just don't seem right.
Stop the vehicle now.
Racism here, reporting from Channel 9 News. I'm here on the scene of the Cliff of Good Health. It appears there is a difference between population health and individual health. Thousands of healthcare providers work every day tirelessly with great effort. The question has been asked, how do we prevent people from crashing at the bottom? Boom! I've been told, Grandpa, that safety nets have been installed for just that purpose. Some nets, though, have holes in them, and some people still fall through the holes of injustice. Fences have even been installed in some communities through planning efforts to keep people from falling off in the first place. But sadly, not all communities have fences, and some just don't work. We've been told that community upstream town that should be there. We've been told that upstream town was built far away from the cliff's edge with many healthy amenities, and disease rates are lower. While this is of course great news, it begs the question of why don't all communities receive the same treatment and attention? Racism reporting for Channel 9 News. And now a word from our sponsor.
Race, the final frontier. No matter what channel you watch, no matter what feed you aggregate, it seems like everybody everywhere is talking about race right now. And when everybody everywhere is talking about race, that means sooner or later you're going to have to tell somebody that they said something that sounded racist. So you need to be ready and have a plan in place for how to approach the inevitable that sounded racist conversation. And I'm going to tell you how to do that. The most important thing that you've got to do is remember the difference between the what they did conversation and the what they are conversation. Those are two totally different conversations, and you need to make sure that you pick the right one. The what they did conversation focuses strictly on the person's words and actions and explaining why what they did and what they said was unacceptable. This is also known as the "that thing you said was racist" conversation, and that's the conversation that you want to have. The what they are conversation, on the other hand, takes things one step further and uses what they did and what they said to draw conclusions about what kind of person they are. This is also known as the "I think you are a racist" conversation. This is the conversation you don't want to have, because that conversation takes us away from the facts of what they did and the speculation about their motives and intentions, and those are things you can only guess at, you can't ever prove, and that makes it way too easy for them to derail your whole argument. And that is the part that's crucial to understand. When you say, "I think he's a racist," that's not a bad move because you might be wrong. That's a bad move because you might be right. Because if that dude really is racist, you want to make sure you hold him accountable and don't let him off easy. And even though intuitively it feels like the hardest way to hit him is just run up on him and say, "I think your ass is racist," when you handle it that way, you're actually letting him off easy, because you're setting up a conversation that's way too simple for him to derail and duck out of. Just think about how this plays out every time a politician or a celebrity gets caught out there. It always starts out as a "what they did" conversation, but as soon as the celebrity and their defenders get on camera, they start doing judo flips and switching it into a "what they are" conversation. "I have known this person for years, and I know for a fact that they are not a racist, and how dare you claim to know what's inside their soul just because they made one little joke about watermelon tap dancing and going back to Africa." And then you try and explain that we don't need to see inside their soul to know that they shouldn't have said all that about the watermelon, and you try to focus on the facts of the situation, but by then it's too late, because the "what they are" conversation is a rhetorical Bermuda Triangle where everything drowns in a sea of empty posturing until somebody just blames it all on hip-hop and we forget the whole thing ever happened. Don't let this happen to you. When somebody picks my pocket, I'm not going to be chasing him down so I can figure out whether he feels like he's a thief deep down in his heart. I'm going to be chasing him down so I can get my wallet back. I don't care what he is, but I need to hold him accountable for what he did. And that's how we need to approach these conversations about race. Treat them like they took your wallet and focus on the part that matters, holding each person accountable for the impact of their words and actions. I don't care what you are. I care about what you did.
Very nice.
Back to Grandpa in the studio with the band.
All right. So that is the story of two sides of our town. Up on the top of the cliff of good health, why some live in safety while others are falling. How much is it due to your color or wealth? Okay, thank you all for listening to our